starting to like come back up and we're like it's really sore even after 3 days, let us know. Usually that means something might just need to be adjusted really quickly before we see you like for your next formal appointment. Because sometimes as we kind of start moving, helping your body move back into alignment, we kind of uncover some other things, and that might be the new spots that are causing you pain and discomfort. If anything while I'm doing the treatment is causing significant amounts of pain, please let me know. That's not my goal. Sometimes I just need to readjust, do a different technique, or your body's not ready to actually have that area treated. Other things are like, oh, you found a spot, it's tender, it hurts so good. If you can stick with me for that one, those ones usually start to unwind as the treatment continues to go along.
I think I had a therapist that may have done something like this where you feel for the knots. Is that the same thing?
So I do feel for knots, but I feel for a lot of other things. So a lot of these people that have like taken little bits and things, like physical therapy kind of took one chunk of it, chiropractor kind of took one chunk of it. There's also naturopathic medicine. They kind of all just have taken different variations. Osteopathic medicine has all of them. I also, me personally, spent a whole extra year training in it additionally. So getting extra tools in our tool belt and looking at things. And those specialists tend to really focus only on one thing. Chiropractic, spine and nerves. A lot of the people that do tissue work really only focus on the muscles. I look at the muscles. I look at flow of things like blood flow, lymphatic flow. There's a bunch of other fluid types of systems in your body that we're trained to feel. So I look at all of that thing holistically in addition to the medical problems you have and kind of see if I can correlate anything and help. I usually call it cleaning it up. So usually there's
it's
like the main.
It's not going to happen at one time.
It's not going to happen at one time for you. Yours is very chronic, but hopefully we can start chipping away at it. There's certain things, if you hear me say clean it up, usually that's just what I use. It's not the main thing that I was feeling in your body, but if there's little bits and pieces that are still like kind of tight or I'm not super happy with, I'll probably just readjust those because I kind of want to leave you in a pretty decent neutral state, but not address everything all at one time because then your body will freak out. And I don't want that to happen because then we'll bring stuff back in that we just undid. So the goal is to try to keep moving you forward, kind of limit some of it. You already acknowledge we're not going to fix all of this stuff in one treatment. We might not even fix a lot of it. It might just help kind of keep the pain at bay or maintain it to a tolerable level, which is still something, yeah. And like you said, since you like to avoid all pain medications, which I think is totally fine and appropriate, keep making it where it's tolerable and you can do the things that you want to do.
The alternative methods, everything from turmeric to reishi mushrooms.
Yeah, reishi mushrooms. Yeah, the turmeric, just make sure you have black pepper with the capsaicin is what activates it. Good, perfect. And then have you ever talked to Dr. Moroka about acupuncture?
I had one set of it and they did it in my ear.
Yeah.
That's the only one I had, and I really and honestly didn't notice much.
Okay.
I mean, I didn't go back for a follow-up.
Okay. So the ear clinic is Monday morning, Tuesday afternoon. Sometimes you don't notice things the first time. It helps to come back every week or two for that at the beginning, because part of it's also just adjusting it to kind of what works for your body. The other thing is if the ear one's not working, consider full body if it's in your budget. I know that one might not be in everyone's budget. It's usually $55 out of pocket for the full body, and then ear one is still $5.
And then there's the difficulty of me figuring out how I would get onto a table.
So Corey's great. Dr. Meyer's great. He would just work with you how you are. He's not going to make you move or anything like that. He actually really just he kind of treats away from the area, so he kind of uses arms and legs to use the needles, and then the ear one's just the ear. But those are also things to consider. Reishi mushrooms are good too. Turmeric's anti-inflammatory, so that's not gonna hurt things.
Lion's mane I take as well.
Okay.
What else do I take? Just one more mushroom, turkey tail. I take that as well.
Okay.
I take some nootropics too, and some immune stuff.
Okay. Any other questions?
No.
And if you hate it, you hate it. You're not going to hurt either one of our feelings if you don't come back specifically for this clinic appointment. Because Dr. Moroka does her own too. It's just scheduling. So usually it's who can get you in the soonest. Okay, I just want to take a look at a couple of things before I start. Like I said, medical doctor first. I want to make sure we're not missing anything.
Yeah, they're still on today.
Yeah.
He's got injuries, so it's hard for the bandages to stay on or to get the sock all the way on. That's why I went with tighter socks, but so.
It's helping a little bit. It's still pretty puffy. The pulses are there. That's good.
I just skinned that today.
Yeah, and it's because it's extra puffy. It's going to be extra to the surface.
That's why it probably tore it skinned easier.
Probably. It feels okay though. I'll take my gloves off in a second.
See where my hardware it comes up.
Yep,
and
I do see it.
that's the
So that's
problem.
also going to be probably pretty sensitive, huh?
Yeah.
No?
You'd be surprised at how good it feels when people actually work.
Okay.
There, that's where a lot of it's trapped too, I think.
Okay.
Like it's just clamped around it.
Around it?
Yeah.
Okay.
And over here, right here, there's some kind of, can't really feel it, but there's like this pocket that sits right here next to my spine, and there, and it feels it. Sometimes it's, I can't feel it today.
Right there.
There it is. There's some kind of like soft mass, almost, like not necessarily mass, but. And that's been there for quite a while, and I've never had anybody look at it, to be honest.
Where it dips down?
Where there's a spot there that gets puffy, right on the left side of the spot.
Yeah, I see the spot. You might have a cyst in there. It doesn't feel like it's super filled up right now. So when it starts to get puffy again, let us know so we can get you in, because if that could be the start that it's starting to fill again, and we can remove it. And the goal is, if we're going to remove it, to do it before it becomes infected, because sometimes it can become infected. Doesn't sound like it's ever gotten infected based off of what you told me, but puffiness coming and going, cysts can kind of fill and drain by themselves. Sometimes they kind of need help, but basically the best way to treat them is to if they keep coming and going, is to remove it and try to remove the wall of the cyst, because that's what allows it to come back. There's not 100% guarantee if we remove it that it won't come back, but usually we can. The overwhelming majority doesn't come back, but it's hit or miss if we got it all out. But it doesn't feel super fluid filled to me today, so that's good. Because if it was trying to fill fluid out, say if you want to get it out, I'll put the referral in, but right now it looks okay. So kind of sit as even and as you normally would. Leave my hand back here, just I want you to sit as normal as possible. I'm just trying to get information to kind of see where I want to start. And again, you let me know if anything's too much, or I'm gonna go more soft and gentle for you.
I'm sure you'll be fine.
Just when it's for most people, when it's been this like it's been there for this long of a time, usually their bodies respond better to soft and gentle, to kind of ease into it first before just going straight for it. If it starts to get a little bit softer or it lets me be a little bit more aggressive, I will, but because I can tell you have a very high pain tolerance, so if I need to be mean, you'll probably be okay with me being mean, but So you're in your wheelchair most of the time during the day?
Yeah, I have a power wheelchair. It's
Okay.
a little more comfortable.
A little more comfortable? Okay, good.
Although if I wouldn't have had it the whole time of my injury, leaning all the way back and that being my normal thing, I wouldn't be probably as curved with my C curve as I am now.
It's possible.
Not
Yeah.
keeping my posture correct.
Yeah. Doing okay?
Yeah.
It's unwinding slowly, so we'll be a little bit more aggressive. See if we get a little bit more. Put one here on your chest. Any stretching or anything that you've tried?
And honestly, not as much as she even tells me to do.
Okay.
I do.
I try to get him to do neck rolls
And we've been
and
Good.
stuff like that.
Good.
And I try to tuck my chin
Good.
and do my neck tucks.
Good.
I've been trying to roll it, and I have been doing my exercise that OT gave me
Good.
for my wrist and arms.
Okay, good. So I think, it's hard to do them all in one day, so definitely do the ones that OT are giving you. Throw in a couple like neck rolls or things like that, but you can alternate which ones you're doing for the rest of your body on the days.
My stomach's telling me I'm hungry, I guess.
Actually, that's a good sign if I'm treating your stomach's going. That usually means
Yeah,
things that are hyperactive are calming down and allowing you to rest and digest. Which your system felt very hot and buzzy before, now it's actually calming down. So
I'm working on my breathing with
yep,
you.
perfect. That's good. That actually helps.
Parasympathetic nervous system.
Yep. I was going to tell you to keep breathing because you're actually doing a good job of. There we go. A lot better.
She does stretch my shoulders kind of out too.
Good.
Push them back like that.
Yeah, I was going to say right in here is super tight.
I'm always doing this. I'm always holding
Or worse.
You really need to do like that rowing type motion.
I work out like that, but I catch myself.
But not like, so did you see how you just brought your ears up and then out? Or your shoulders up to your ears? You want to try keeping them down and only bring it back. Yeah, like that. Because before you went up and back. I don't want you going up and back, just simply straight back. Because up and back is going to make these tight, and I just released all of those, and that's partially what's causing this to stay up. And this side is going to be more dominant to further contribute to that curve. But this is both tight and weak. So like a rowing type motion.
To hold myself.
Yep.
Because I right below here, I have nothing that I feel it. I know that doesn't mean there may not be something there.
But you can't
After 17 years.
Yeah. happy with the movement we're getting. Nice big deep breath in and out, and hold it right there because that's just gonna help it go. Good. You can start breathing normally. There we go. Now we have some good spring in there. Like this side, but not as much. So
I'll have to shift my weight.
whatever's comfortable for you. I'm working around you. I'm just trying to get some good natural movement back in. Drink tons of water today because there's a lot of stuff that's just been sticking there. So drink tons of water, help flush out those toxins, and it will help reduce how sore you are. Good. Just had a release. Okay, good. That went all the way down to low back. I'm gonna sneak in through here. So I flip this spot in. There we go. Good.
I've had a lot of damage in this one too. This one, the femur was broke. I had metal put into my knee, and then it got infected. They had to take it back out.
Oh
of my knee.
no.
So it's not even on straight. I don't think. If you look at my feet, it's like they just stuck it over. So I went
Yeah.
walk in, and they just.
And your hip links are also the
These
fact
hips
that
out of place.
yeah,
As well.
that's also not helping your curve. Let's see. I won't be able to do much.
It's
but
been out
we'll
of place
see.
for probably about 15 years.
Ever since the accident
Well,
or
yeah,
after that?
shortly after.
Shortly after.
Once my leg joint started loosening, and we'd stretch my legs and just pop out.
Okay.
And they relocated her like 3 times, and then gave me the options to either cut it off with the floppy joint, but it wasn't hurting. So they just gave me the option to not address it.
Okay. That's fair. If it's not hurting you, it's one more surgery to heal from.
I don't want all surgeries. I understand that my situation may, require something.
I think when it does, but there's no need to jump to the knife.
I mean, they tried to tell me my first appointment over the last doctor, he wanted to replace all my hardware in my spine. That's my entire spine. Infuse my entire neck.
Oh wow.
No.
What was the reason why?
Just because I guess because the top up there it's pulled out of the top 2 vertebrae, and they can't probably just screw it back down, I'm sure. But it came out of the top 2 screws that come loose.
So if they're gonna go in there to replace the screws and
replace the hardware,
Yeah.
actually move the hardware to a different spot where they can screw. I don't know. But that just the sound of the conversation steered me so far away from trying to hear everything they were saying.
Sure.
This other doctor saying that you have a complicated situation. We're going to look at one level at a time, address where the pain's at. It was more of a manageable way than a doctor like looking at the X-ray and my hardware and saying, "What did you do?" I mean, with that almost tone, it's just like, And then you want to talk. I remember the surgery that I had, and I mean, I remember how much it put me down
The first time.
20 years ago.
Yeah.
I'm not down for that. And
Totally
I'm
fair.
ready to ride this chassis out.
That's understandable.
I didn't do range of motion or anything in the beginning like I should have been doing.
I mean, there was a lot to adjust to.
still matters.
Well, you're working towards it now, so give yourself credit for the now. Perspective's important, but also being kind to yourself in the now is important too. There we go.
Remember that.
Okay, so now we have some movement in there. Lung's actually looking better now after that. Good. So just everything was just so closed off. So helping open all that stuff up, helping some of the fluid get back up. Because if everything's closed off, it's gonna make it harder for the fluid to go back. This side's still pretty puffy, but this side was pretty stuck. Okay, let's see. Hopefully that'll come down a little bit more. How are you feeling?
Feels good.
Okay, let's move your neck around. Alright, that's actually a lot softer than when you started. And I can turn your head pretty easily. Before I was like really fighting you. I think this is a good stopping point for today. I'm pretty happy with that. Let me go grab Dr. Maroka.